What eventually disappeared and no one noticed? Our need to know who our neighbors are. I listened to a podcast about human interaction recently, and the host said that the internet slowly made it possible to live without knowing who the people are next door. It used to be that we would hang out with people in our street or attend dinners, birthdays, and whatnot. Now, everyone seems to have no need to even so much as introduce themselves. The only time we do get to know each other is if we have a complaint. CD/DVD drives and laptops. Toys and cereal boxes. Somewhere along the way 9 to 5 turned into 8 to 5. We're in the process of full-size can of Arizona teas for $0.99 disappearing. I'm seeing a lot of places starting to carry the smaller plastic bottles for $0.99 or the larger plastic bottles for more. I'm honestly surprised that they've lasted for this long at the same price. Longevity in careers. This is a big one nobody seems to have said. Longevity in careers has largely gone away. People used to get a job and after being there for decades reap the benefits of being seasoned employees, higher salaries and better perks. Maybe it's because I work in the entertainment industry, but I feel that longevity in careers has gone away. Meaning, people can be amazing at a job, but after 5+ years the employers start wondering if they could be doing better with a younger/cheaper candidate for the job. I understand if you ever want to move up in a workplace they expect you to bring your A game, but 30+ years of being incredible is hard. Some years will be better than others, and if employers don't have loyalty to their employees anymore, it is likely the good employee will be fired or let go at some point. I feel like in recent decades this has forced many people who normally wouldn't, to switch careers. Can someone work successfully up the ladder at any job without having to shift to another company for a promotion? A combination of employers halting upward movement of their staff while they look for new employees to fill higher roles, and the fact that they get bored of their seasoned employees has largely killed the idea of anyone having a single career. I never see swarms of monarch butterflies anymore. People fainting when something unexpected happens. And people carrying smelling salts for just such an occasion. It's so 19th century. L33th speak. I can't even nail down the decade it disappeared. Those god-awful Chevy commercials with the real people, not actors. One day, I realized I hadn't seen one in a while and it was almost as if they'd never existed. Except I knew they had. Man, I hated those damn things. Soap drinks. I don't know, I didn't notice. Reminds me of a Hitchhiker's Guide to the Galaxy quote. You know, said Arthur, it's at times like this, when I'm trapped in a Vogon airlock with a man from Beetlejuice, and about to die of asphyxiation in deep space that I really wish I'd listened to what my mother told me when I was young. Asterisk. Why, what did she tell you? Asterisk. I don't know, I didn't listen. Kinda surprised I haven't seen this one yet, but Ronald McDonald. You remember the old clown everywhere in and around McDonald's commercials and stores? Gone. Phased out when that clown scare prank trend was going around. Those rubber bands shaped like things that you wore on your wrists. Gaming consoles at McDonald's. Surgeons/doctors of Reddit. What's the dumbest thing patients have lied about? Not a doctor, but in patient care nonetheless. One guy comes in, between 17 to 19 years old, for pebble hits penis. Pretty odd. He says he was doing yard work when the tool knocked a pebble into his penis, he went to check it, and now it was making pus. Nurse clarified that he was wearing pants. Denies sexual history. He stands by that he got hit on his penis by a rock through his pants that made him produce pus. He had chlamydia. Guy says he was forced to do meth, or something similar, at a store. Came in because he thought he was dying. 3. A fun bonus, a frequent flyer comes in for his stomach hurting from eating this chili he had. While continuing to eat said chili in the lobby. Edit, I have a few funny other stories that I'm just going to add for the fun of it. Woman comes in after doing crack and states now she feels sad. That's all we got. Older woman who OD'd on something says she thinks her son poisoned her who she hasn't had contact with in years. Old man with various infections, but his pubic hair was green. We still do not know why. Guy came in for vomiting on Thanksgiving because he ate too much but it was really tasty. No other complaints and felt fine now. Addict left AMA because he had to go to meth right now. He was in for other issues but had to leave immediately to do more meth. He eventually came back for treatment thankfully. Minor comes in for poisoning. Turns out, she had food in the microwave, sprayed said food and microwave with roach poisoning, then ate said food and vomited. Now, comes into ER on Thursday, events happened Sunday, because she was having contractions. Edit for clarity LOL, she was also 27 weeks pregnant. And eating roach poisoning. Woman comes to emergency with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in her vagina. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange, peel still on. Oh, that. We heard it would improve our fertility. You can't make this shit up. Do you have any medical problems? No. So no diabetes. No diabetes. What medications are you taking? Metformin. For my diabetes. I facepalm every time. I had a guy insist that someone else put cocaine and heroin in his urine. Even after I tried to move on with the conversation. Adherence to medical treatment when I have literally pulled their pharmacy records and know they haven't picked up their medications in over a year. Deleted. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy, asked if solids consumed in 24 HRS prior, patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior visit. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse. Patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know he says he can actually move his legs again but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics, Dilaudid. I tell him no because this story makes no sense. By God it was a miracle I tell you when this man walked himself right out of the hospital after I refused the 4 narcotics. Also, the MRI was normal. Patient, I haven't drank alcohol in months. Patient's family, it's true I've been with her the whole time. Me, ma'am your alcohol level is 325. Patient, impossible. I would never lie to you. Did cocaine the night before elective surgery, didn't disclose at pre-op. Cardiac arrest. Beta blockers and cocaine don't mix well. One my favorite things I wrote my first year out of medical school. Please note patient has stated multiple times that he wants to leave and would leave AMA, against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then, patient was complaining of a headache. Was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Do you smoke cigarettes? No, I quit. When did you quit? This morning. It's not so much a patient lie as it is me being dumb, inexperienced, and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic and I had been yelled at by patients previously for asking do you have sex with men, women, or both. It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights but I wasn't sure how it would go over to admit it. That's when the bleeding started. It was a very important lesson for me. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave report to the MD, and when I walked back in with the doctor she looked at me and said I didn't think you'd be coming back in the room, and then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. What's your rule of thumb when it comes to sex? Every minute invested in mutual foreplay is a minute of better sex. If you can't talk about sex with them, don't have sex with them. We all know our bodies and what we want better than anyone else. You will never have bad sex again if you have it with someone you can talk about it with before, during and afterwards. If it doesn't fit, don't force it. It's not fun unless we're both having fun. Practice good hygiene prior. Especially trimming the fingernails. Bring a towel. Don't forget where you put down the keys if you're using handcuffs. Never moan the wrong name whilst in handcuffs. Always pee afterwards. Wash your dick first. I'm not kidding. Don't give her a UTI. Wash your dick. Ideally, wash your entire body by taking a shower, but if you're pressed for time, at least wash your dick. I always make sure my thumbnail is nicely trimmed and filed. Young dudes, don't use porn as a guide. Most women don't want to be choked or spanked or whatever you see on Spank Bang. And if they do, that's a discussion that needs to be had, or after you two are comfortable with each other. Treat people how you want to be treated. If a girl stuck 3 dry fingers up your ass without your consent, you prob wouldn't like it. Eat the pussy first, then it won't matter as much when I only last 30 deacons. Shower before. Sorry. But no TV. My ADHD is bad enough. Last thing I want is to go limp dick noodle inside ya cause someone's making a mean ass hamburger in the background.